September is National Suicide Prevention Month, which is meant to raise awareness and prevent suicides.
You know, there are about twice as many suicides in the U.S. as there are homicides. News 9's Robin Marsh has today's Medical Minute.
There are about 130 people who die by suicide every day.
Suicide is the 10th leading cause of death in the United States. It's top 3 among young adults and adolescents.
The rates of mental disorders linked to suicides are also on the rise. Studies show depression rates in the U.S. tripled in the early months of the pandemic. And a study from Boston University found depression now affects 1 in 3 Americans.
We know that depression is a major risk factor for suicide attempt.
There are steps that can be taken to reduce this risk factor and others.
That oftentimes just starts or can begin with telling someone, a friend, a family member, or a doctor that you are in fact struggling.
And if you know someone who is struggling, you don't have to wait until they talk to you. Be sensitive and ask them direct questions such as, are you thinking about hurting yourself? Do you have access to weapons or things that could be used as a weapon to harm yourself? Studies show that talking about suicide actually decreases the rate of suicide. And also, you can encourage someone to speak to a mental health professional and never promise to keep someone's suicidal thoughts a secret. And if you or anyone you know needs help, you can call the National Suicide Prevention Hotline at 988. For today's Medical Minute, I'm Robin Marsh.